Let's talk children, Dr. Pauling. Children of when should a mom bring the child to the dentist? And also a little bit, what should a mom pay attention to, do or maybe not do when it comes raising that child, especially, even before or after they have, while they're babies? What's important there to do?
Okay. The recommendation these days for kids is that when they have teeth, that they should see a dentist. In the past, they've talked about 3 years and things like that. Our experience with kids is that to improve their cooperation and their experience at the dentist, if they're familiar with it. The first time that a baby comes in, there's not going to be a whole lot that we're going to see or do with them, but as they become accustomed to coming to the dentist and being evaluated, it makes it easier for them.
It's a good thing that if a young child, be it 2-year, 3-year-old, be it whatever, if a young child comes and there's no work to be done, because the last thing I think a young child wants, or you want to have a young child to experience, is that coming to your face thrill. So it's better to have no work to be done and make the experience simply a experience. Open, let's look, and all wonderful. So basically the kid gets used to a dentist. So when there's work to be done, and educated, I assume. I'm sure you educate the kid a little bit, right?
Exactly. Part of the visit
at 2 years, it's difficult to educate the kid, but as it grows,
and it's to get accustomed, but it's also a good time for us to educate the parents as well.
The parents, yes.
We can talk about some of the things here, but we would do a more comprehensive kind of evaluation of habits and things with the parent and diet and that kind of things when they come in. One of the most common problems with young children and dental problems is what they call, the baby bottle decay and things like that. Just the way decay happens is when there's sugar there, from whatever source, it's fuel for cavities, and that can come from milk, it can come from juice, and whether it's formula or mother's milk or cow's milk.
So it's not that the baby is not allowed to drink those things. You just don't want the baby to go to sleep with it, right?
Exactly.
And what do you do? What about if that baby wants a bottle in the mouth? Well, how do you fix that? Because parents need to sleep. When kids are crying, parents do need to sleep. In Austria, I know what they did. In Austria, they put the lollipop into a glass of wine and gave it to the kid, and 3 minutes and the kid is gone. I'm not so sure that's a good method, but
yeah. You do have to do what you got to do with kids, but we don't want them to have a bottle in their bed all night, and it's not good for them to fall asleep with milk and pooled in their mouth. You can try a pacifier or you can try water. Those would be much better options. But just try to also, you don't want them running around all day with a bottle either. Constantly taking little sips is much worse for the teeth than trying to have regular feedings and things like that.
Does it like constantly sucking on a lollipop or on a bottle, does it deform the teeth? They go like pulled in front or in back, whichever way, I don't know, but is that a problem with it?
It can be a problem with pacifiers and bottles and things like that. Another big problem is thumb sucking or finger sucking, whatever the kids do. It can have an effect on the teeth. Generally, kids are going to do that and it's okay, but around the age of 3 to 4, they really need to get rid of those habits, or it can have some longer term effects that won't be easily corrected.
I got it. Well, let me ask you another question here. So a baby became a young child, 5, 6, 7 years old, I really don't know anyway, and what is the incentive for a mom to, let's say, if a kid has too big of a cavity, why don't you just let the tooth fall out or pull it out and don't worry about it, because after all there are more teeth coming afterwards. Why should a mom, a dad, why should parents keep the baby teeth in good shape when in a couple of years they're gone anyway?
Yeah. Well, some of those baby teeth have to last up to, age 12. In some cases, 13, 14-year-old kids will still have those baby teeth there, and that's actually a significant amount of time. Also, if a tooth is lost prematurely, it can have an effect on how the adult teeth grow in. It can make it more difficult for the adult teeth to grow in. Teeth can start to grow into each other, and it'll cause problems that make it more likely that the kids will need braces and things like that in the future. So we definitely want to keep those baby teeth until it's time for them to go.
I see. So basically what you're saying is that the baby tooth have a function to channel the bigger tooth into the right way, and that's why the child needs to be observed, so that maybe the tooth comes out at the right moment when the dentist decides that there's another one wanting to go in, but this one didn't come out, or that you keep the tooth in strong enough to make sure that all the teeth, just like with orthodontic or with missing teeth as an adult, because if the baby teeth get too crooked, the teeth below will become also crooked, and that spells a very bad orthodontic bill for the parents.
That's right.
And quite some hassle for the kids to wear those things,
Definitely. They can make, even if a kid would need braces, if they had maintained their baby teeth, it will make their treatment a lot more complicated, and sometimes the teeth won't even be able to grow in at all, depending on what happens.
Right. Okay, well, wonderful. And besides, most likely, I'm not 100% sure, 8, 9, 10, 12-year-old kids, they probably are already more self-conscious and want to look good. It doesn't just start at age 16 and above. Just like we, thanks God, see rather old people, 70, 80, getting implants and doing things wanting to look good, because, why should there be a limit when it doesn't matter how you look? I mean, that's right. So I think children are probably rather self-conscious, and you don't want to have them running around. Even though those teeth come out and new ones are coming in, I guess you want to make that little kid being in kindergarten or in first grade or whatever it is still look pretty good, right?
Right.
Good.
Absolutely.
All right. Wonderful.